Hey, it's Jessica DeMassa with WTF Health. I'm here at the HISA studio at HIC 2019, and joining me right now, I have Michael Walsh. He is the Director General for Queensland Health, which is a massive health system here in Australia, right? So it's for the entire state of Queensland.
It is for the entire state of Queensland. It's 100,000 employees providing healthcare services for 5 million people.
That is great. I mean, that's really cool. So I want to pick your brain from a big hospital system standpoint. What's going on with the digital transformation here in Australia? How are you guys doing?
Well, what we understand is that digitally transforming the health system is going to provide better outcomes for patients, and it's going to be safer to be able to provide those. But it is a challenge making that transition because you're introducing a third person in the room. You've got your clinician, you've got your patient, and then you've got technology. And the challenge for us is to make sure that the technology helps the patient engage more in their care and helps the clinician provide better care.
All right, so how's that going? Because, I mean, around the world I go and I hear, not horror stories, let's not say that, but I hear that there's a lot of challenges, particularly in terms of, like associated with EMRs, physician burnout. They don't want to type into the computer. They want to look at their patient. There's patient satisfaction issues with that. What's going on in Queensland in your health system?
So we're making sure that we engage the clinicians as we roll it out.
Yeah.
The clinicians have configured the system.
That's unique.
Yes, it is unique.
Say more about that. So what do you mean?
So we started off with our base electronic medical record application, and then the clinicians have built the pathways, the care pathways through that. They've built the forms and the screens and the layout, as well as the functionality of how they can create favourites in their system, so it becomes personalised to them.
And so, are you getting less griping than others maybe around the world are getting?
Any change program that involves 100,000 people is hard.
I was going to say, that's a very carefully worded answer there, Michael. Lovely.
It is very, very challenging. One of the things that we have done that has really helped us is, because we're rolling it out across a large number of hospitals. We've already implemented it in 16 hospitals, and we're going to be doubling that in the next few years. But in my role, I go to the hospital a couple of times before they go live, and I sit down with all of the clinicians and have a conversation about how they're finding the training, how they're finding the change management, how they're finding the system, the risks and issues that they're dealing with. So it's a real transition. And at the end of the day, they decide to go live. So if they say no, we're not ready, or we don't believe this is the right time yet, then we delay it. The only go live is a successful go live.
Okay, that sounds great. Does anybody push the limits on that, or do they know they've got to do it eventually and they get their act together?
Well, there's been a couple of times where we've rescheduled the go live, and that's completely supported by the system.
That's awesome.
That is welcomed. Because at the end of the day, we need clinicians to lead this, and we need it to be safe when they implement it.
So when you go back, and even if it's anecdotal, what kind of satisfaction rating are they giving the implementation of their EMR?
When we go back after the...
You're like, we never go back.
Yeah, no, we do go back. Everyone that I talk to who is in what we now call a digital hospital says they would never want to go back to paper and pen. They say it's just fantastic. And we're seeing huge benefits where a patient may need to be transferred from a lower acuity hospital to a tertiary hospital, and the clinicians in doing that transfer can see the same record at the same time and be able to provide continuity of care. It's actually really helped.
So you are in the process of digitizing.
Yes.
And then with the ones that have already gone digital, then there's another problem, right? There's the problem with the data now.
Correct.
So talk to me a little bit about what you guys are doing there, because this, I think, the nuance of how multifaceted the digitization, we just talk about it so casually, the transformation of healthcare.
Yeah.
So easy, but there's multiple steps involved. So the ones that are further along that have digitized, what's going on there? How's it going with the data? Are you guys able to do any aggregation, looking at population levels and impacting things there? Give me a sense of what's happening.
Yeah, that's a very, very good question, because in the early days of our implementation, it was all focused on rollouts. So it was this hospital was going to go live and then the next hospital. Now up to 16 hospitals, we've actually got to be able to optimise and improve the system that's already operating in the hospitals that have got it, as well as roll it out. So it becomes a more complex, challenging program. And what we're finding is the clinicians in the hospitals that have already got the digital platform can sometimes be overwhelmed with the amount of data that they're presented with,
Sure.
and how and where to get it from and where it's coming from. So we have a whole program of optimization, and the way that we present it to people is we don't want to be like the lone mariner who's stuck in the middle of the ocean and says water everywhere, nor a drop to drink. Because the equivalent in the digital transformation of hospitals is data everywhere, not a piece of useful information to be found. So we are involving the clinicians in how do we actually take the data that's available, do the business analytics and over the top of it, and provide it back to them as useful decision support or useful information to help improve care. It's also about preparing for genomics and personalised medicine
Right.
as it moves forward.
So it's interesting to me because I think to myself, God, I hope you've learned from the mistakes of other countries that have rolled their EMRs out in different ways, and it sounds like you have. And I'm curious to know, I guess, like as far as the government is involved. So you guys are a publicly funded hospital system.
Yep.
So, and I know there are private health systems here as well in Australia. But as far as the government is concerned, we're all curious. Especially all of the startups out there that are like, I have a solution that might help you make sense of that data.
Yep.
So, what is the appetite, I guess, for investing in digital solutions that are outside of the EMR?
Yep.
So, I mean, I understand this is a massive undertaking. I don't want to minimize that,
Yes.
but there are other things. There's telehealth solutions. There
Yep.
are things that patient-centric applications on phones that can help
Yep.
with chronic condition management. Is there an appetite for investment for that from the federal government as far as health systems are concerned?
Absolutely.
Okay.
I mean, the government wants...
Is it a big appetite?
It certainly is a big commitment.
Growing? It's a growing appetite? Okay.
growing commitment and growing appetite, yes. I mean, the things that government wants to achieve in investing in healthcare is that they want to achieve a healthier population, a healthier community. And so whatever investment you're going to make has to translate into people being healthier. But it also has to be more sustainable.
Mm-hmm.
We have to ensure that as investing, we're becoming more efficient in the provision
Sure.
of healthcare services. And if you look at healthcare generally, we have shorter lengths of stay. We have overnight procedures able to be moved to day procedures. We have operations that are now shorter because of the use of robotics and so forth. And in the digitisation, we also have to do that for clinicians. So and being able to provide that information back to clinicians means they can make more timely decisions, and it means you can have a faster pathway through care. Also, people spend a very small amount of time in a hospital. They spend most of their time in the primary care
Right.
setting, and so governments want to invest in ensuring that the focus is on the patient and the patient's interaction with the healthcare system, whether it's with their general practitioner down the road, or whether it's in a hospital, whether it's getting an X-ray or having their bloods taken. And so we have to make sure that we're implementing systems that interoperate across the primary and acute care settings and focus on the patient's journey through all of that.
So as far as, and this is so different than my framework from the US. I mean, it's like, it's just so different.
Yeah, it is.
But I wanted to ask, as far as the hospital's priority then, so the health system's priority, we talk about those like the enterprise priorities.
Yes.
What are some of the big problems that you are looking to technology to solve? Interoperability is obviously, something that's on the roadmap there, I'm sure. But what else? Are you guys looking, I know Australia has difficulty with hospital infections. What kinds of things are you looking to troubleshoot where it's like, yes, technology can help us here?
So technology is fantastic at helping us provide care. When you talk about a deteriorating patient, being able to have the technology monitoring that and triggering particular decisions from clinicians at points in time, make sure that the person is caught before they deteriorate. Being able to provide access to results from pathology tests mean that they're not repeated, and so you have an efficient system, the same as X-rays, that they're not repeated. These things are really critical. We're also wanting to make sure that we get the technology to turn it into helping the clinicians make their decisions. We see great benefits in artificial intelligence and assisting diagnosis and clinical decisions. It will never remove the need for clinicians, but it will certainly aid them and speed up their ability to undertake their work.
How do startups get involved with big health systems here in Australia like yours? Is that possible for them to even reach you? Like in the US, the health systems have created a lot of different pathways in now. A lot of hospitals will have an innovation group and they'll have a strategic investment arm, something that kind of is scouring the fringe and the bleeding edge to bring some of these things in, or even looking in-house at what their doctors are already using and then figuring out how do we scale this.
Yeah.
Is there a similar type of innovation program in your health system?
Absolutely. We have an innovation hub
Okay.
that we invest in, and it's in a place called the Valley.
Ooh, of course it is.
of
That's where
course,
you
that's
put the
it.
innovation hub. That's a universal thing.
Exactly, but it's not Silicon Valley, it's Fortitude Valley.
Fortitude Valley. That sounds actually quite nice.
But it's still the Valley, and that's where we invest in these in startups and applications that may or may not succeed. We see it's really important. You've got to have your long-term,
Sure.
stable platforms implementing an electronic medical record, but around that, you have to be looking at innovations that and invest in those and fail fast or succeed, and then scale them up. And one of the things we're really why we do that at a statewide level is because we want to be able to, when they are successful, apply it everywhere.
Well, yeah, I mean, you've got like how many hospitals? 32?
Well, there's going to be 32 on this electronic medical record, but about 150 hospitals.
Oh my goodness. Okay,
Yeah.
so wow.
Yeah.
Yeah, no,
Yeah.
absolutely.
Yeah.
Scaling is key then.
Yeah, yeah.
Wow. Okay.
Yeah.
So I understand you are chairing this HIC conference next year.
Yes.
So I want to know then, as far as the digital health conversation here, and digital health in Australia, I think for those who are not from here, it's really right now, it seems to me mostly focused on electronic medical record and the things surrounding that.
Yeah.
So we define it maybe a little bit differently depending on what country you're in,
Yeah.
adding in
Yeah.
digital therapeutics
Yes.
or
Yeah.
other health technologies.
Yes.
But so as far as the conversation at HIC next year, what are like the big things that you want the speakers on stage and the people who are attending the meeting to be talking about?
Yeah.
What are some of
Yeah.
the priorities?
So the three focus areas for HIC next year are about the consumer,
Okay.
the patient, the clinician, and the data.
Okay.
And so what we're wanting to be able to talk about next year is how those three things work together to ensure that the patient has a better journey and better health outcomes, the clinician's able to provide the best care that they can, and what we would say the best care in the world, and that the data is there serving both the consumer and the clinician.
Being drinkable.
Being drinkable.
Drinkable, yes.
Very drinkable, that's right. Been through the desalination plant and actually useful.
Exactly. Fantastic. Well, Michael, thank you so much for spending time with us and talking with us. It's a pleasure to hear. I'm so fascinated by your health system here, and so it's interesting to talk to somebody who's sitting at the top of Queensland's health system run by the government. That's fantastic. So thank you for the
Thank you,
insight.
Jess. Thank you.
I'm Jessica DeMassa with WTF Health here at the HISA studio at HIC 2019. Thanks a lot for joining us.